Good evening, ladies and gentlemen. Dr. Les Odison, broadcasting from Xidlo TV, based in Shangri-La, my place in Pakalani, Gaborone, Botswana. Today I'm going to talk to you about thromboembolism. I want to do this because there's been some reports of some people developing clots in people that have taken the AstraZeneca vaccine. And as a consequence of this, some countries have decided to temporarily suspend the rollout of this vaccine. It looks like there have been 30 cases out of 17 million. I mean, 30 out of 17 million is a very low number. Therefore, I suspect this is just an incidental finding and there's no causal relationship. That's my suspicion. I mean, I can't be absolutely certain, obviously. But what is a thromboembolic phenomena? Well, essentially, if you take a drop of blood and put it on the surface, it will clot. You will see that it becomes thicker and it's no longer, it doesn't flow. That basically can happen. What can happen inside your deep veins inside your body? When that happens, that thing is called a thrombus. The clotting is called a thrombus. Now, that thrombus, part of it can just move away from where it is and goes onto the right side of the heart, go into the lung and block an important blood vessel into the lungs. It can happen, just block one big one, or it can block several blood vessels. If this happens, that's called a pulmonary embolus. That's a very, very dangerous situation, and therefore we have to be very careful about such issues. That's why they've stopped the rollout of this vaccine in Europe and now here in Asia as well. Now, what are the predisposing factors to this phenomena? Well, you can have it after having surgery, any period of immobilization, surgery, pelvic surgery, orthopedic surgery, because you are immobilized and you're not moving around. You can also get it after a long journey because you are just sitting there. Say you drive from here to Kasane. If you don't move your legs around, you may develop this phenomena. It can happen in pregnancy. It's rare. It can happen in women taking the contraceptive pill or on hormone replacement therapy. That's also very rare, but it does happen. You can also get it in smokers and obese people. So those two, you have to watch them very carefully. The danger, like I said, is because the blood clot can dislodge and go into the lungs and cause you serious problems. Now, how do you diagnose this condition? Basically, you do what I talked to you about the other day. You apply the clinical approach, the scientific approach to medicine, history, examination, and investigations. The history, I'll just look at the things I've already spoken to about. Do they smoke? Are they pregnant? Do they take a contraceptive pill? Have they had a long journey recently? The kind of questions, they will probably complain of a painful swollen leg. When you examine, you can see it's bigger than the other one. You touch it, it's tender. If they have a pulmonary embolus, they will be breathless at rest. They may complain of coughing blood. And then you can start suspecting that they have a pulmonary embolus. For diagnosing DVT, you do an ultrasound scan called Doppler. This look at blood flow within the blood vessels. It will show the thrombus if it's available. There are other investigations such as venography where you inject dye into the body to look for that. CT scan, a fantastic test. It will show the thrombus both in the lungs as well as in the leg. Treatment, once you've diagnosed this condition, if it's a large pulmonary embolus for any surgery, you can do what's called an embolectomy. They take you to theater and take it and surgically remove the clot out. But most situations, you use a blood thinner that will dissolve the clot away. There are different types of drugs that are used for this. And you'll probably have to take them for 3 to 6 months to ensure that you're fine. In fact, in pulmonary embolus, you probably take them for about a year or so. Like I said, with regard to AstraZeneca, I suspect this is just an incidental finding. I do not believe that the vaccine is causing this phenomena. Because, like I said, 30 out of 17 million is not much of a number. But people are just being careful. And this is a new vaccine. We have to try and look at everything. If I would love to be able to get access to the case notes of these people that developed this and to see they have predisposing factors. Maybe if you found they've got predisposing factors, such people maybe you should not be giving them the vaccine. But, like I said, it's a new vaccine and let's see how it pans out. Thank you very much for listening and good night.